My name is Dr. Vinod Raina. We are going to talk on HIV. HIV is the infection which, if once goes in the body of any human being, then he will be infected once for all if he comes positive. What is the meaning when a patient comes HIV positive? Guys, there is a threshold limit. When you do a test, if the limit is more than 1, that means the patient is suffering from HIV. He is HIV positive. Moreover, when we do a test which is called HIV PCR, if in that test we get cells more than 20 or more than 50, then the patient is suffering from HIV. So, once a patient is HIV positive, then we have to see that what is his level of immune system. The immune system is indicated by the cells which are called CD3, CD4 and CD8 cells. They have got the significant importance in detecting the level of HIV in your body. In normal human beings, the level of CD4 should be from 600 to 1100. But in case if a patient is suffering from HIV, the level of CD4 can come down. What is the reason? Once the virus cells enter in the bloodstream of a human being, the CD4 cells come and they engulf the virus. Once the virus is engulfed, then they attempt a suicide. By doing a suicide, self-suicide, they kill the virus cell. In that scenario, what happens? The level of the CD4 will decrease. So, when the virus increases, the level of the CD4 will decrease. So guys, if your CD4, if you are HIV positive, is more than 500, it is practically normal. Then you need not to worry about it. You can still take the antiviral drugs. But in case if the CD4 count is less than 200, then what? From 200 to 500, the CD4 is normal. There is no chance of getting secondary infection. The chances are very less. But if the CD4 count comes less than 200, then definitely a patient is not suffering from HIV, then he is suffering from HIV AIDS, acute immunity deficiency syndrome. So guys, what happens in AIDS? When a patient is suffering from AIDS, his immune system is at very low and he may suffer from secondary diseases. So what are the secondary diseases which can infect the person? It can be gonorrhea, syphilis, chlamydia, trichomonas, herpes. It can be tuberculosis. It can be human papillomavirus, VATS. It can be hepatitis B. It can be hepatitis A, C. And many diseases. Typhoid. There are a number of, the patient can have loose motions, the weight loss, the loss of fluids, the rashes on the body. There can be rashes on the whole of the body. There can be polyuria. A patient can have frequent urination. When he is urinating, he can have burning sensation. He can have pain while doing sexual intercourse. So, these are only few diseases. There can be more diseases. I cannot list all the diseases which can occur when the CD4 is less than 200. So guys, there is a catch. If you are HIV positive, your first and foremost duty is to maintain the CD4 count. So what you can do in making the CD4 from 200 to 500, you had to stop junk food. Don't take any junk food at all. No burgers, no pizzas. Maintain your sugar level. Sugar level should be normal. If you are diabetic, then the problems can be more. If you're hypertensive, the problems can be more. And if there are more diseases, then the problems can be more. So, the improvement of the lifestyle, you had to walk. Get up early in the morning, walk for 1 hour. In 1 hour, you had to walk 6 kilometers. You can jog. You can take almonds, 10 to 15 almonds daily. You can take walnuts, 1 to 2 walnuts daily. They contain fatty free omega acid. They are very important. It's a very important element in the body. And you can, if you are a non-vegetarian, you can take fish. Fish is a natural protein. And if you are taking fish from the sea, that is free of pesticides. And you can take, if you are non-vegetarian, you can take chicken, mutton, you can take beef, you can take eggs. But if you are vegetarian, then what? You can take cheese, the paneer, which we call in Hindi. You can take broccoli. You can take beans. You can make a soup of these all vegetables, tomato, the onion, the lesson. What is called lesson in English? I forget name. And you can take ginger, garlic. Lesson is called garlic. These are important things. You can take number of herbs. They can reduce the CD4 count. So guys, if you had to maintain the CD4, you had to stop taking junk food. You had to stop taking the diet which is full of oil. No fried items at all. So, if you are able to maintain CD4 up to 500 or more than that, then there are definitely chances that you will not have secondary infection and your body will remain fit and calm. Moreover, you have to take proper drugs. The regime of the drugs is very important. It's very important that what are the drugs you are starting. If the CD4 is less than 200, then the regime of drugs will change. If the CD4 count is from 200 to 500, the drugs will change. And if it is more than 500, the drugs will change. It depends on the level of CD4. So guys, the message of today is, if you want to live well, healthy and fit with HIV, then please take care of your CD4 count. If you have got any more questions, you can just ring the bell. You can subscribe us. You can write me on the mail. You can call me on 9136363692. My number 9136363692. This is the patient education program which is run by Dr. Vinod Raina. Guys, if you have got any question, you please write me. I will try to call you back. I will try to answer you. So, guys, today we are taking off. See the videos, subscribe our channel, and live healthy and live wealthy. Thank you.